This is STIRRUPS, Candid Conversations in Women's Health, the podcast where we answer your burning questions and discuss the evolution of women's health through every stage of life. Join Dr. Randolph Scott and duly certified women's health nurse practitioner and certified nurse midwife, Kerry Autry, as they discuss the unique health concerns women face and share expert advice to assist you on your journey to maintaining your health and wellness. If you're looking for informative discussions, tips from qualified professionals, and a community dedicated to women's well-being, then you're in the right place. This is part 2 of our discussion on postpartum care, where we'll dive even deeper in how to navigate this crucial period. If you haven't heard part 1 yet, make sure you go back and listen.
Pain relief. We talked about the immediate aspect in terms of the delivery and the swelling that takes place. The biggest pain relief that you'll be given is really through the ice packs. Mm-hmm. And the ice packs don't have to stop once you leave the hospital. I think it's certainly appropriate. Now, the ice packs probably won't have much of a benefit 2 weeks later, but certainly I think to cool things down as you're starting to gain your mobility, move around, and so forth.
And then ibuprofen.
Oh yeah. We got medicine. We got good medicine now.
Exactly. But I mean, honestly, if once you've gotten home from the hospital and you're recovering, even if you had a C-section, by 3 or 4 or 5 days after that C-section, if you have pain that is not well managed with ibuprofen, that's a sign you need to make a phone call to somebody. Like ibuprofen should pretty well manage most of your pain by, postpartum day 5, 6.
Especially the prescription strength. Now, Kerry, what are your thoughts about actually sitting in the bathtub post-delivery?
The sitz baths can be very, very helpful. So in fact, I usually recommend, especially somebody who had a lot of swelling and a lot of discomfort, a sitz bath, which it is like a fancy thing that you can get a prescription for, or you can just put a couple of inches of water in the bottom of your bathtub. It can be very soothing.
Oh, I think that's fantastic. Even for our moms who have had stitching.
Oh, absolutely.
Your stitches are not automatically going to fall apart if you soak in the bathtub. It'll accelerate the healing that can take place. It'll minimize infection. Mm-hmm. And then it's just a moment, perhaps without that baby. Okay. Just a moment. Now, I don't know if that baby is going to allow it. Okay. But it is just a moment to kind of regroup, recover, and promote your own healing.
But, it's like a real life approach. Often when I was a young mom, I would get in the bath. My husband would hand me the baby. I'd bathe the baby and then he would take the baby away. So we got the baby's bath done at the same time. I got a few minutes because he would take the baby away. So it was also it became a nice ritual for us. It was healing and a good opportunity to take care of the baby and a good opportunity for him to take the baby.
Well, you guys were efficient. I like that. That was awesome.
We are nothing if not efficient. Yeah, the Army will do that for you.
Okay. All right. Kind of hit on some of these other things already.
I was going to say, I think we should talk a little bit about things, because we've talked a lot about things that are normal, things that we expect.
Right.
And most of the time, that's what's going to happen. And I tell patients all the time, like, I'm a midwife. This is the way I practice. I'm just going to assume that things are going to roll along the way they're supposed to until I have some reason to think otherwise. And there are things that we do need to watch for postpartum, and some of them really can be quite serious.
Yeah. And the transition is a great one. I don't want to understate that. It's a very impactful time now. The emotion, everybody's excited. And I've said this before too, but there's a fair amount of anxiety about caring for a human. And, it's a huge and tremendous role, but I know that all of our parents are up to the task, and we want to try to help them meet that task at the same time. But what kind of problems can be major problems? I think that's worth at least having some discussion about. I think not every pregnancy is perfect. We have some patients that are having high blood pressure. Mm-hmm. High blood pressure can even last through the postpartum period.
Right. We can even have patients that didn't have high blood pressures through pregnancy, then deliver a baby, and then all of a sudden have high blood pressures.
Oh, yes. And that's no question about it. Yeah. And sometimes it seems like it comes out of nowhere. And sometimes, it's something that's very organized. But high blood pressure can be a major factor. Sometimes patients can actually develop seizures as a result of blood pressures being significantly high, and that's a warning sign. So the hallmark for a lot of our patients, what I want them to understand is that life will be challenging, but from day to day, you should feel some sense of things getting better. If you are developing uncontrollable headaches, or if your vision is changing for you in a way that, hey, this is not just my eyes are watering because I'm crying about being happy about this baby. That's something that you should recognize. If your abdominal pain is getting worse, it should be getting better, whether you had a vaginal delivery or a C-section. Right. If you're bleeding and it's increasing, you get to the point you're soaking through your pads, or large, tremendous clots that are just...
Which I feel like we should put in perspective, because when you and I talk about large clots, I don't think we're thinking the same thing as most people. So when we're talking about large clots, we mean something like the size of your palm.
Yeah. Yes.
Size of an egg or the size of your palm, anything like that, we would consider a large clot, which at least warrants a phone call.
A phone call, that's right. Or further evaluation for you. And so those are some of the signs that we can see, but some of it is intuitive, some of it is not. Another one that can certainly be a hallmark of something problematic if you're short of breath at rest, because you shouldn't be short of breath at rest. Right. If you got significant leg pain, one is bigger than the other, and you're just like, man, the back of my calf is this just isn't right, then, perhaps it's calling your provider, to kind of get things checked out. If you are febrile, meaning if you have a temperature and it's 101 degrees, then, we got to figure out, hey, you shouldn't be having fevers at this point in time, right, regardless of what's happening for you.
Running a low-grade fever, like 99, maybe 100 is normal postpartum. Anything beyond that, though?
Yeah, no, I said 101. I started to get a little touchy once it's about 101, 100.5.
Yeah, exactly. If it's over 100, I'd like to know about it.
Yeah, if we're getting over 100, but you're right. Sometimes you can have a low-grade temperature from milk let down and things like that. But, if it's something persistent, the shakes and chills. Now, initially, that's something to talk about for the shakes and the chills. So initially, what do you see happen sometimes, patients? So
initially, right after you deliver, especially, patients will just shake, and it can really startle people because it's sometimes enough that like your teeth will chatter. It's usually a pretty significant amount, and it's just because of that dramatic drop in the hormones.
Yeah.
And speaking of hormones, that postpartum period, most people aren't prepared for this either, but in a lot of ways, your hormone state postpartum is very similar to menopause. So people can get hot flashes, you're going to have vaginal dryness, you may have the mood swings, you may have all those things that can just be part of that hormonal shift. It's like a nice little preview.
And then the elephant in the room for us is really the depression and anxiety that can take place post-delivery.
Absolutely.
And you can never be fully prepared for it because that shift is so dramatic. And for the happiest, go-luckiest person, it still can hit them in a way where it's very impactful. And trying to recognize that sometimes is a challenge for some patients. There's actually all kinds of ways to help us figure that out. Yeah. And the most important thing is to try to recognize some of the signs of the depression that can take place and how to get help if you actually need it. And so what are some of the things that you have seen that would probably prompt you to call your doctor about some of the experiences that you're having?
I mean, the good thing is at this point, you know your doctor pretty well because you've seen them like 100 times over the last year. So hopefully you feel pretty comfortable making a phone call, even if it's just to say, I'm just not sure. I'm not sure if this is normal. A a lot of patients experience at least a teariness. You just start crying at like the drop of a hat. And that's usually, I mean, in the books, it's like the 2-week mark. For me, it's just been motherhood all like, from the moment oh my gosh, from like the moment I was pregnant, I remember watching a Hallmark commercial and just like bursting into tears and not realizing like that was my new normal. So that there's that kind of teary point at the 2-week mark. And that's fairly normal and we expect it. If it's got you concerned, make a phone call and ask. But that should get better over a couple of days. That shouldn't persist. If you notice after that you're feeling you're having a lot of trouble getting interested in doing normal things, getting interested in getting up and taking care of the baby. If the baby feels so overwhelming that you just can't get through the day, anything. And if somebody else says something to you, try to hear that with a heart that knows that they're looking out for you and they want what's best for you. But make sure you've got that support system and, maybe have a conversation about it before you deliver the baby. I've never done this before. I don't know what's going to happen, or I have done this before, but I don't know what's going to happen this time because every time is different. So, if you can help me watch what's going on and I'm going to probably bite your head off if you say something, but give me a minute to think about it and we'll come back to it. But really leaning on that support system.
The support, and then to really support yourself in the sense that this is an imperfect process. We are imperfect people, and to give yourself grace and mercy about what's taking place and the changes that are happening to you. I think as parents, we are all very hard on ourselves about what happens. We're fully responsible for, everything that takes place. And you'll realize once they get teenagers, you're like, I'm not responsible at all for what happens to somebody else. They make their own decisions. And so it's a little bit of a precursor for us. But at the end of the day, I want patients to understand that this is, there are a lot of handbooks out there, but nobody ever fits the mold with respect to how things happen within your own household. And so you really have to give yourself some grace and mercy about the transition that's taking place. Which leads into, the next step is, your support, your spouse, your partner, about what that means, being able to help your partner, through this very challenging circumstance. And, from a dad perspective, we hear that 6 weeks and we're like, all right, 6 weeks, my eyes are starting to get big. All right, bedroom activity. I got it marked on the calendar. 6 weeks might not be appropriate, depending on what happens along that course. And so being able to understand and make adjustments about what that means, particularly for moms who are nursing as well, sometimes they feel all touched out. You got a baby hanging from your boob and you got a husband hanging from your boob at the same time.
Maybe toddlers.
Right. And you got perhaps other kids in the household. So just having a conversation and understanding about where you are and what that means for you and both your partner, I think it's actually a great conversation to be had. And so that expectations are met appropriately for both sides. And so recognizing when there are problems, from a dad, and looking at my wife go through this very life-changing, I can promise you this, after you have a baby, you'll never be the same. It's a life-changing moment. But if we fall into your traditional gender roles, it's going to be very difficult. Meaning mom's just supposed to take care of the baby and I'm supposed to, come home from work and not necessarily assist her, help in some of the challenges that she faces, can make it a much more difficult circumstance. And being able to perhaps maybe clean the bottles, okay, is maybe the dishes. I think, one of my wife's favorites is, how about do a load of laundry? And so,
laundry.
Yeah. So there's not only emotional support.
Laundry, oh man, the baby laundry. It looks like such a small load. But then you were folding forever and ever and ever. Those tiny little socks. Oh my word.
Let me tell you, my firstborn.
They multiply in the dryer.
My firstborn, I thought he had a hole in his mouth because he drooled all over the place. And now I'm not taking anything away from, the real issues, but the laundry that just kind of piled up just from bibs. I mean, just bibs alone was tremendous. And so being able to help from both an emotional and very physical aspect can certainly shorten up that window, that phase in terms of the challenges that some of the moms and dads will face going forward. So,
I think, I've said this to many patients. I have a lot of respect for dads. I think it's got to be hard. I would so much rather have been the mom.
Okay.
Because I feel like, guys seem to be built like they're just, you give them a problem and they're going to fix it.
Yeah.
You can't fix pregnancy.
Yeah.
You can't fix labor, and you can't fix a baby.
Yeah.
You just have to kind of stand by and watch it all. And that's got to be a really hard place to be. So I think, for both parties to have understandings that this is really hard for everybody. Babies are joyous, but they are hard. Yeah. They are cute, but man, they are tyrants. They are going to take everything they need, and they won't give a lot back for a long time. So just,
we do get some back?
I don't know. I'm still waiting.
I
mean, I get a nice text from my 18-year-old every now and
Okay.
then.
All right. We're 18. All right. I'm waiting for it.
But it's hard and it's demanding, and you're doing it all on very little sleep. And, for mom, she's also like physically beat up. No matter how she had a baby, she's physically beat up. Yeah. And now she's got this whole hormone thing going on too. So it's hard for everybody. And I love the way you said it, because I tell patients all the time, I'm like, just give yourself some grace to know that you're not going to get it right all the time. Yeah. Parenting is by far the most humbling thing I've ever done.
Can you say that again?
I know it is. And my husband and I, we made a promise to ourselves early on that we would make the best choice we could in that moment with all the information we had. And we wouldn't question it later because you did the best you could in that moment with what you knew in that moment. And that comes to diapers, which people can feel like is this overwhelming thing. Buy the ones that are on sale. It's okay if not everything is organic. It's okay if, your house doesn't look like Pinterest all the time. Those aren't the things that will matter in the long run. Just give yourself some grace and remember that this is hard for everyone.
That's a fantastic way to end. I love it. And so, on to the next one. Thank you guys for listening. We appreciate it.
Thank you for joining us on this episode of Stirrups. Be sure to send us your women's health questions and topics you'd like to cover by visiting our website, CarolinaEliteWomen.com. If you enjoyed today's episode, please subscribe to the podcast and spread the word by sharing it. To find out more information about Carolina Elite Women's Care, visit CarolinaEliteWomen.com. This podcast is edited and produced by Earfluence. Stay healthy and stay empowered. We'll talk to you soon on Stirrups.